Welcome back to The New Norm with Dr. Lou Graham, brought to you by Midway Dental and Catapult Education. Well, as of now, 48 states have declared national emergency for the COVID virus. And per my friends in New York City, they are now saying that they hear sirens basically 24 hours a day. And reportedly, one patient is dying per hour in New York City. That's where we're at today. So just to recap a little bit from what we've already covered, we've already discussed with a lot of you, and I appreciate the thank yous the whole team does. We've covered employment thus far and how to handle your team. And we've also covered how to really close your office, because doesn't look like it's going to be just 2 weeks. And potentially how we're going to be reopening when we do reopening, which we will be doing. Okay. My next interview beyond today's interviews will be with Carson Carpenter. He is an OSHA expert, and we're going to be talking really about the latest on the CDC guidelines, how to practice really more safely, tips on such. We're going to dive deeper into what is emergency dentistry. That becomes critical. And really what disinfectants work and what don't in our offices. All really pertinent things. And then the nice part is Carson will then be doing a 45-minute webinar later this week, CE credits, and we'll be hosting that, which is really exciting. Okay, now today I am hosting, I'll say, 3 great experts on teledentistry. Teledentistry, it was a word I didn't even know what it was really up until 2 or 3 weeks ago. My first guest will be a Dr. Miles Cohn. I'm going to read a little bit of his bio. He's the owner of Nuance Dental Specialists, which is a private practice limited to prosthodontic dentistry in the heart of Portland, Maine. He's also the editor-in-chief of the American College of Prosthodontics quarterly publication, The Messenger. Joining Miles will be his wife, Cornelia. She's responsible for the office's practice management and running the overall office. So we're going to have both of them pitch into our questions. In addition, I'm really, really excited to also hear from Mark Genus. Mark is a PhD in counseling psychology, a former clinician and researcher. He is the co-founder of ICE Health Systems, which is really cool from what I'm learning more and more, is now partnered with Midway to bring advanced teledentistry and clinical record systems to dentists in the US. He'll also be working with SmartMirror and Dan Hakabi. This is where we're all going with Midway, all very exciting. Okay, that's my introduction. Miles will be presenting a live webinar later this week, and maybe 2, one this week and one next week, on teledentistry, and I'm hoping I can convince Mark to do the same, because we all need to learn so much about this. Okay, Miles, let's start with this. Miles, what should folks be paying attention to? Thanks. What should we be paying attention to?
So we're really making a shift here now to teledentistry, right? And so maybe Miles can just give, for most of the people who aren't familiar, like Lou, you had mentioned you had really not heard about teledentistry until very recently. So Miles can maybe just give us a little bit of a definition of what it is.
Yeah, and it's interesting, Lou, because like you said, you had no idea what the word was even until about 3 weeks ago. With current situation in the world now, everybody's really starting to focus on this. And teledentistry was actually coined nearly 25 years ago. Cook in 1997 defined teledentistry as a practice of using video conferencing technologies to diagnose and provide advice about treatment over a distance. And it's interesting too, because with my background in the military, this is where teledentistry actually first got its auspicious beginnings, with military folks trying to communicate over long distances. And teledentistry is really just a rapidly forming subset of telehealth or telemedicine, right? And telemedicine has been around since the 1920s and was officially introduced and being used in the 1950s. So this is nothing actually new, but everybody's starting to come online
Wow.
with it, no pun intended.
And essentially, Lou, what we're trying to do now is, with the changing situation, is that we're using this idea of minimizing the distance between the patient and the practitioner with technology. So the fact that the dentist and the patient are not in the same location, you need to use teledentistry to make that somewhat irrelevant. And it provides a way also for people to eliminate the waiting room and that face-to-face consult, but still getting the same support and supporting our patients in the same way.
And a lot of people are kind of intimidated by the thought of using teledentistry now. Obviously, there's a technological aspect to it, but most people in one form or another have been using teledentistry most of their careers anyway, right? Anytime we send radiographs or a referral form or photographs to our laboratory technicians, when we do that, we are essentially using some form of teledentistry.
Interesting. So let me ask, I want to pull Mark into this then. So Mark, as a psychologist, give me your thoughts on the experience a patient now is having through what Miles and Cornelia are talking about through this teledentistry. We'll get to how this all works. Tell me, what are they experiencing through this in the new norm?
Well, it's wonderful to be with you. Thank you kindly. And I'd agree with completely everything that Cornelia and Miles are talking about. And from a patient perspective, I think it's really important because particularly in these times, patients are alone. We're used to having a relationship that we often even take for granted with our providers, our caregivers, their staff. And in times like this, when we don't have access, it's an extremely lonely experience. So having that connection, and the better that connection is, the better, and the more that can be done. But having that connection and retaining it is psychologically, I would submit, extremely important to keep up people's morale, keep them moving, and keep them working with preventive health care. I actually really worry about people staying in place, if you will, and slowing down their day-to-day routine to the point where they don't bother with prevention. And so I think really the connection and the ongoing connection with your support professionals is critical.
Love it. And as we talk about this, then I'll shift back to Miles and Cornelia. Then really, Miles, in your experience, both of you, how should folks be paying attention to this? What are your thoughts about this before we get into the benefits and the gains on this? What should we be paying attention to?
Well, again, the fact, Lou, is, the landscape of how we practice dentistry literally changed overnight, right? I mean, one day we were in our practices. I mean, just a couple of weeks ago, I was meeting with you in Chicago, right? And everything was fine. It's business as usual. And then the next day, we're all quarantined at home, and we're all trying to keep our kids occupied and keep our minds occupied. Right? Yeah, and then there's this real feeling of being isolated, right? And that psychological component really comes in, like Mark discussed. So, yeah.
And I would say that the way that we've always practiced dentistry is it's really kind of almost like a contact sport. We are in there with our patients, in the practice, meeting with patients face to face. And now all of a sudden, all of that face to face interaction has disappeared.
It's gone.
And the challenge now is, how do you find ways? Our central promise to our patients are that we are going to provide you with support and good quality information, and we're going to help you to keep up your oral health. But the way that we've always done it, the norm has completely changed. So our patients are still going to be looking towards us, but we need to make sure that this doesn't become spectator sport now. Right? Where we're just completely distanced and the patients feel like there's none of that support that we used to provide them at all anymore.
Right. Physical hands off, but we still have to be deeply involved in their care.
No. Oh, listen, there's no question. And I want to get back to Mark, but I think what this really relates to is if we're doing emergency dentistry, and it's going to be that way, I think, for at least 2 to 6 to 8 weeks. This can really help us determine when to see a patient and when not to. So with that thought, Mark, I want to turn it to you then, because you really have some unique answers to everybody. And before we get to billing and fees, which of course is important, and I'll have Miles and Cornelia talk about that, you offer a great solution. And I think people watching this are going to go, oh my God, I can't believe there's a solution to this. So let's talk about your solution and how this solution can really be almost ubiquitous in dentistry. Talk to me about your solution.
Well, thank you very kindly. The items that you've been talking about the relationship and about being involved, perhaps you're hands off formally and physically, but the more involved you are, the better. We've had the pleasure of working with a variety of dental and medical professionals from around the world for a number of years who have basically brought forward and said, what we need is we need a secure solution, like we need security in our office. We need a system that is properly secure, that is not having patients download items to their computers, because then your security effectively is heavily threatened. We need it to be easy to work with. All we need is a browser, and to be able to have proper video and audio and contact, and a doctor needs to be controlled. We also need to do other things, like if we need to show them something from their chart, we need to be able to share their screen. We need to be able to take pictures. So if I'm with a patient and I need to take an image, I need to be able to do that, and the patient isn't going to know how to position a camera or when to take it. So I need to be able to control when to click their camera from my side as a doctor. So little things that are seemingly little things have been put together under the guidance of a number of docs from throughout the world that we think is a properly externally audited secure system. Requires no logins or registration or cost on the patient's side, so it's easy for them, is accessible 24/7, and is expandable across the country right now. So we're grateful to the docs for all the work they've put in on this.
Okay, so wait, I want to focus in on answers because that's what I want to get through with this segment.
Sure.
So let's just say all these dentists are out there watching, and we have already a ton of followers. Is there a link that they can link their office to download this? What's the fee involved, and what's the process, so that if you're going to be, I mean, do we present a webinar step by step? Walk me through what offices do with this, and then I'm going to shift it over back to Miles and Cornelia. Please walk me through this.
Sure, it's simpler than that. So contact your Midway rep. The information is at icehealthsystems.com.
Okay.
You don't need to download anything. All you need is through your Midway rep to request access, and we will give you your own private access to it. That way, again, we're not getting access to and able to infiltrate your computer. The security is essential here for the provider, the professional, and the patient. So it's as simple as contacting your Midway rep. We'll provide you with a password and a username, a little bit of training to get you going, and you're off to the races.
I love this. So again, even though I know we're broadcasting to everybody, for people who want to follow up on that, and this is absolutely not trying to be a commercial, this is a solution, is you would go to really education at midwaydental.com and just leave us your information, and a Midway rep or a Midway representative would get back to them and follow this installation process. I think that would be great. Now, Mark, let me ask you, if I asked you to present a webinar on this and its impact, would you be able to do that in the next week or so? What do you think? I know I'm putting you on the spot.
No, these are times of crisis, 24/7, whatever you need.
Yeah.
We're doing this for people all over the world, in multiple countries, I'm pleased to say, and we're only too honored to serve our neighbors in the U.S. Absolutely.
I love it, and believe me, I can't believe how exhausting we all are trying to do this. Okay, so now we're doing teledentistry, and now openly, I think, Miles, I want to get to both liability on the dentist standpoint, and with Cornelia also, what codes can we be billing? And I know we're going to cover a lot of this in your webinar, but could you kind of touch on liability and codes? Take it over, you two.
Yeah, so liability is always going to be a big thing, right? In any healthcare profession, liability, accountability, those will always be, major factors that we have to consider. And of course now, the issue comes up, what happens when we're treating somebody that's potentially across state borders, right? I'm in Maine. What happens when Somebody in California calls me with, some tooth-related pain or an emergency, right? And I have to consider, potentially calling in antibiotics or painkillers to somebody that I've never met, 3,000 miles away. So there's liabilities that are always going to be there in place, and there are resources available now, and we'll have links to this after the webinar, during the webinar. Those resources are out there for people to take a look at, and we don't like to give hard and fast rules about what people can and can't do, because it does vary by state. And obviously now, with the way that the world is changing literally by the hour, a lot of those rules are becoming more lax now, because government realizes that we are in a time of unprecedented crisis. And so what do? There's a lot of people that are going to be in need. There's a lot of people that are going to need emergency health care at some point, and the time to take drastic action is now. So that is changing rapidly.
I would just add to that, I think this is where consent forms are going to become a crucial component of protecting dentists against potential liability there. So we will go into that a little bit more into the webinar, and then just to quickly touch on the codes as well. So there are 2 teledentistry codes that were specifically set up for both an asynchronous and then a synchronous encounter. The one being a live video encounter, that's the synchronous one, and then the other one is what they call a store and forward kind of encounter. And the problem with those are that there's not a lot of medical insurance that would cover those. I think Medicaid is one of the only ones that would really recognize those 2. So there are a few additional codes that can now be used as stand-in codes, and then depending on how you do your consultation, you would either use something like a limited problem-focused examination or evaluation code, depending on exactly what you do during that consultation. So that's something that we will just go into a little bit more in depth in the webinar as well.
Yeah, and those CDT codes, I'm pulling this from the top of my head, Lou. I think it's a D9995 and a D9996. I believe those are the new codes. There's two teledentistry codes that the ADA recognizes now.
But let me just say though to both of you, I think the webinar is essential, because we got to understand what we are doing per what Cornelia just said, so that we're doing this correctly. And I love having all the legality covered with documents and everything else. So Mark, in your secured system, are there consent forms that we can send out? I'm just curious, because I don't know your system yet. I'm certainly going to know it by the next 2 days. How does that all work?
We do have the telehealth system is actually part of a full practice management or electronic health record system, where there are forms and you can create your own forms. But Midway is preparing to make that available to the market in the coming weeks. Immediately, however, we would suggest you follow what Miles and Cornelia will tell you about using forms directly with the patient, and use the telehealth specifically for the communication element at this point, and then we'll wrap it all together in a little while. Let's just get going, get serving patients, and keep the doors open on our businesses.
Okay, so as I close as I close this session, here's all I can commit to all of our viewers. I'm going to have to invite all 3 of you back probably next week, because things will be changing. I'll have more questions, viewers will have more questions, but I think this is a great start. And with the webinars upcoming this week, I think we'll be all over teledentistry by next Monday. So I want to thank everybody for being here at the new norm. Appreciate
Terrific.
it. Appreciate
It's a real
it.
pleasure. Thank you.
Yeah.
Thank you very much.
Thank you all. Thank you.
Thank you.
So let me be clear. We want to hear from you. We want to hear your questions. So what we want you to do is we want you to go to education@midwaydental.com. Shoot us your questions. We'll go right to the experts. I know I'm not the expert, so let's go ask the experts what we should be doing as our next step next week, the week after, and thereafter. I look forward to hearing from you.